I'm Deepa from Central College, a Department of Gerontology. I'm here to discuss something about our topic. It's called Overcoming Stigma, a unique challenge to older adults with mental health issues. So before starting, can you just introduce yourself, please?
Can I which?
Introduce yourself, please.
So I also have to, I have hearing aids, so I'm hard of hearing, so sometimes with masks on, I might have to ask you to clarify.
Sorry.
So. No, that's all good because my hearing isn't good. So my name is Sheila Adcock and I'm the coordinator, contract manager for Career Development Services. We provide outreach services in the community for people living on their own. We run the Lenina shelter for individuals that are homeless. We have a variety of different programs. So we do employment services, outreach, homelessness, that type of thing with vulnerable populations in Trail. So we provide a lot of people support.
Yeah, thanks a lot for that, Sheila. Nice to know you.
Have you ever felt left out or judged by people because they thought you were different from them? Maybe you've been discriminated against. How did this affect you? Maybe you felt misunderstood, embarrassed, alone, or even afraid. That is what stigma might feel like. So what is stigma? Stigma is a set of negative beliefs and prejudices about a group of people. Stigma also includes negative behaviors towards groups of people. Many people face stigma because of their race, religion, sexuality, gender, economic situation, and a variety of other things. People living with mental illnesses often face stigma and discrimination. This can make them feel ashamed, hopeless, distressed, reluctant to get help or accept help, and feel like they are to blame for their illness. In fact, almost half of Canadians thought people use the term mental illness as an excuse for bad behavior. And 27% say they would be fearful of being around someone who has a serious mental illness.
And can I just ask something question regarding what are the factors that can cause stigma towards addiction or mental health illness?
We've been talking a lot about that lately, and that's where we, the Trail Community Action Team that I sit on, we're looking at developing a whole bunch of anti-stigma ads, media ads on the TV, paper ads going out, because what we're finding is a lot of the community have some preconceived ideas about what mental health is, what addictions is. And we're finding that a lot of the individuals that experience substance use issues are being targeted. So kind of by these, labeled as, less than, they preconceive that they might be dangerous or steal, that kind of thing. And what we're doing is trying to change the community narrative, because there's many forms of addiction. People when somebody mentions addiction or substance use issues, right away they have a preconceived idea of what that person will look like.
Of course.
We've had the same issues in the past ongoing about people with disabilities or learning disabilities. Right away you think of the worst case scenario of somebody who's disabled, and then you meet people and you think, this person, when we look at individuals dying yearly from drug overdoses, it's not the homeless people in the back alley, it's your neighbors, it's your brother's friend, it's people that are going to college. There's many forms of substance use that right now is unsafe. So I think when people think of substance use, they think of the worst case scenario and they treat people badly. So a lot of the stigma these guys wear.
Why is that? Well, many years ago, mental illnesses were not well understood. We didn't know how mental illnesses influenced a person's brain or affected their thoughts, feelings, and behaviors. People with mental illnesses were not treated with the support they needed and were considered outcasts or even dangerous. To end stigma, people need to understand and accept that mental illnesses are like any other health conditions and need the right treatment. We would never say to someone, just think positively and your diabetes will go away. But how many times have you heard, try to be happy, think positively, don't be so depressed. You have so many good things in your life.
Yeah. So what do you think that, what is the important thing we should do to reduce stigma?
I think we need to watch our language. We see a lot on TV or even speaking to each other. If somebody says to you, oh, that's just an addict, correct them.
Yeah.
It's not an addict. We don't say, oh, that's just a diabetic or that's just a heart patient. This person, it's a person first, and this individual has some substance use issues, just like anybody else. So we need to watch our language, because we can put people down, encourage stigma just through what we say. And if you go on the internet and talk about, Google language matters and stuff like that.
Yeah.
There's Towards the Heart is a really good website for resources, and it has a sheet that talks about, instead of saying addict, this is what we would say.
Okay, like towards the heart.
Toward the Heart,
Yeah.
And that one has a lot of resources and anti-stigma stuff. If you join the Trail Community Action Team, there's a bunch of media ads and stuff that we are promoting anti-stigma work. So if you go onto the Trail Community Action Team on Facebook and join that, there's a lot of posters and a lot of information on there.
Yeah.
So that's where most of our effort right now is, to break down the stigma, because people are being targeted based on other people's opinions. So
Let's look at an example of how stigma can hurt someone. Stefan is a first-year university student. He likes his program and has some new friends. However, Stefan feels stressed and overwhelmed by all of his schoolwork and being away from home. He's not feeling like himself, and most days he doesn't want to get out of bed. He's afraid his friends will think he's weak if he tells them, and he doesn't want anyone seeing him at the clinic, so he doesn't reach out for help on campus. His feelings get worse, and he's having a hard time staying in school. Like with Stefan, the stigma people experience often prevents them from getting help and support from family, friends, and professionals. We know from research that the sooner someone gets help, the better the outcome will be. This is true for all health conditions, including mental illnesses.
I think that age difference have like something to do with stigma. Like older people get more stigmatized, or like young people, or like adults. Is there any specific category or like
no, I think it's anybody that has obvious mental health or addictions issues, substance use issues, are targeted. I think people forget that that's a small minority of the people that have substance use issues.
Okay.
It's across the economic status. It's across all ranges. It's not just the homeless people in the back alleys. It's
like everybody. Like, and I want to ask, like, what encouraged you start to come to like serving the people in the outreach like this? Is there anything like background you have experienced to come?
No, I got my social work certificate. Started out in at 38. I went back to school and got that. Yeah. And then I started working in the field after that, and started from job coaching to employment counseling, and then started managing all the programs and stuff. So
Okay.
I think it takes a specific kind of individual that likes to work, because it's not static. Like, it's not like every day I come and I do the same thing. It's every day I come and we do something different. Whether it's somebody with substance use issues, whether it's somebody with learning disabilities that needs somebody to advocate for them, it's something that's always different, which is what I like.
Okay. How do you experience that people come to get services in shelter home? Like, so many addicted people come to our shelter home, right? And how do you feel that they will be getting lots of services from us, and how do they take that services?
We have the shelter is based on harm reduction model, just the same as our the home we run that you work in.
Yeah.
It's based on the harm reduction model. So if somebody is under the influence of any substance, we don't deny them service. We bring them in. We watch out for them. We also help get them hooked up to mental health and substance use counseling in the community. We help them, that kind of thing. But we don't promote using in the shelter. But we don't deny somebody services if they are using substances or coming under the influence. We still give them a bed and some food, and it's better to have them in there where we can watch them than out on the streets.
I think we should be like non-judgmental when they come inside, because like we don't know what's going to them.
No.
Yeah.
Most of the individuals that have have chronic homelessness, mental health, they have substance use issues. Not all of them.
Yeah.
Some of them have mental health. Some, we have to remember that they've got most of them have a traumatic history, some kind of trauma in their past, and And so, yeah, we need to be fair and be compassionate. It takes a lot of compassion to work in this, and no judgment. Like I say, we have to be careful with that. And I've had other students that come in and said, I didn't think I was judgmental at all until I started and thought, oh, wait, I wonder where that came from,
Yeah, really.
So we need to change the narrative and watch how we speak about people.
Yeah. And what do you think, what is the negative consequence of having stigma, like, in them, and like, if you are stigmatized, what are the negative consequences that occur to that person?
They don't get the support that they deserve because people judge them as unworthy or that they should just quit. So there's it's not a deviant personality. It's addictions is a medical issue. So it's not like something they could just stop. They need supports in place to deal with the hurt that they've had in the past, deal with their mental health and the trauma issues, and work their way towards becoming well. But people assume they should just quit, and it's not as easy as that. There's medical. It is a medical issue, just the same as anything else.
Do you think that you get enough support from the public to like for our shelter and the work you do?
I think so. Yeah, I think the city's on board, and the different the municipality is on board. The different organizations, we're all coming together to provide wraparound services. So if somebody comes to the shelter that has mental health issues, we can contact Interior Health Mental Health Services and say we have somebody here that's struggling, and they have.
It's a coordination of work.
Yeah, it's a coordination. They have street outreach just like we do, and we have a street outreach program where we can go into the streets. There's different services provided in the shelter, but the street outreach just go to where people are and find out if they're in crisis, what they need, how to help them. We also intervene if there's any negative impact from the community, people going after them or stuff like that, and encourage them to make positive changes in their world, and or give them some hope that things will be better. Yeah,
they need hope really to move on.
Housing is a huge issue. There's no housing in this community or any community, and what there is way so expensive. So for somebody to feel supported and well and get their basic needs met, they need that before they can move forward in any other area of their life. And we're just providing the very basic. When you look at Maslow's hierarchy, we're only providing the basic. We have food, clothing, safety in the shelter, but
we need a shelter, right, to move on.
Yeah, we're working towards trying to build supportive housing so people have a place to go that is staffed and meets their needs that in the community.
Okay. And do you ever experience any older people coming to our shelter home and having with both addiction and mental health illness, and how do you deal with that?
Older people, yeah, there's lots. There's seniors. There's a wide range from. We take shelter guests from 19 to whatever age. We've had 70, 80, 65-year-olds, lots of seniors that are there. Based on losing their housing needs. We're seeing a lot more seniors being evicted right now, rent evictions, and people are buying the house and want to renovate and want the person out, and we're within our Getting Home program trying to fit that need of getting people housed in the community, but it's getting harder and harder.
Okay. And is there any relationship between addiction and mental health, like it's mental health issues, directly or indirectly?
I think at the homeless shelter you see that correlation, but mental health individuals with a chronic mental health diagnosis, I believe, struggle to maintain their housing probably more than anybody else.
Yeah.
So they end up homeless, and regardless of the addictions issues, I don't think it's housing based is not typically only about addiction or substance use. It's and last question, what are the takeaway for us as future nurses towards care of people who use drugs and who are stigmatized to our society? I would say spend time to get to know the person, treat the person, not the diagnosis, because just because somebody has substance use issues or mental health diagnosis, sometimes the person gets lost in there. So you have to be compassionate, you have to care, you have to be respectful. We need to respect their need for immediate care at this point. I think a lot of the stigma they get from, resources in the community, others is based on they're not worthy of the support due to the perception that they have a choice and they're choosing to use drugs, so they need to bear the consequences. And substance use and addictions issues are not a choice. It's a medical issue that we need to deal medically within the medical field for sure.
Yeah, sure. Thanks a lot, Sheila. I'm so grateful that we had a conversation regarding that. We come to know that we need to be having more compassionate, and we should really non-judgmental towards them to come out of that stigma.
So, how can we reduce stigma and help people like Stefan? 1. Think about your own feelings about mental illnesses. Do you have biases or judge people? 2. Be aware of language. Avoid using words that can be hurtful, like psycho or crazy. 3. Think about and discuss what you see in the media. How people with mental illnesses are shown in the media is not always accurate or fair. 4. Learn more about mental illnesses. Check out trusted websites like the Canadian Mental Health Association or Bell Let's Talk. 5. Explore relationships with people in your life who have mental health challenges and illnesses. After watching this video, make a list of ways you can help yourself and your communities become more accepting of all people, including those of us living with mental illness. Think about one thing you can do now to help reduce stigma around mental illness. It could be a small thing, like not using hurtful and labeling words. It could be reaching out to someone who you think might be struggling and encouraging them to get help. It could be sharing your own experience living with a mental illness with someone you trust, if that feels comfortable and safe for you. All of these things help reduce stigma and keep it from stopping others and ourselves from getting help when needed.
Thanks a lot.
Yeah.
Thank you.
Thanks.